of Latinx children live in families whose incomes fall below the federal poverty threshold. And we know that just and living wage employment opportunities, which are necessary to combat poverty, are even more limited for undocumented Latinx in California. In a 2021 statewide survey, respondents cited high food prices and inconsistent or not enough income as the biggest barriers to getting enough food for themselves and their families. And of course, things have just gotten worse over the last few months, literally, due to inflation. So that's takeaway one, causes. Can we go to the next slide, please? Takeaway two is consequences. So for Latinx adults, there are both long-term and short-term consequences of food insecurities, such as development and worsening of chronic diseases like type 2 diabetes, in which Latinx are overrepresented. The same goes for Latinx children, who can develop long-term health and learning complications that can impact them well into their adult lives. And food insecurity also results in more expensive healthcare costs over time for Latinx, as they continue to develop chronic diseases and must incur additional healthcare and prescription costs. So food insecurity and associated coping strategies increase physician encounters, physician office visits, emergency room visits, hospitalizations, and expenditures for prescription medications, costing individuals facing food insecurity an extra $1,863 in healthcare costs annually, as compared to food secure individuals. So, it's all related. If you're spending more money trying to address these chronic diseases, that's also contributing to the poverty, right, that you're experiencing already in your household. So next slide. Takeaway three is programs. So in terms of what is available to combat food insecurity, we of course are familiar with programs like CalFresh. Yet statewide, CalFresh fails to reach 30% of eligible individuals. And of course, still has some restrictions around eligibility for those who are undocumented. So we must eliminate all and any restrictions solely due to immigration status to fully reach the potential of CalFresh. Moreover, survey results have shown that Latinx applicants did not complete food assistance applications due to a lack of resources available in applicants' language, in addition to hostile or unwelcoming environments while filling out those applications. Next slide, please. And so finally, the fourth takeaway is anti-immigrant policies. They do contribute to food insecurity. From 2016 to 2019, so we're talking about Trump era years here, there was a 34% decrease in mixed status families participating in California's CalFresh program. So that meant that 276,000 children in our state lost access to critical food benefits throughout those years. So this is caused by fear stemming from anti-immigrant policies, such as the public charge rule, whose application has been scaled back with the Biden administration, but whose impacts are still felt among immigrant communities. So policies like public charge and lack of cultural and linguistic competency to enroll immigrant communities into nutrition programs contribute to food insecurity among Latinx and immigrant communities. So that's some data that I wanted to share from our report. I will stop there and allow my co-panelists to illuminate some of this data and expand on this data. So thank you so much.
Thank you so much for that, for sharing all of this information. Ben, I did want to go ahead and go to you. After listening to the data that was just shared, how can the Food4All campaign help address food insecurity among undocumented Latinx and other immigrant communities?
Yeah, that's a great question, Jeanette. What I'll start off by saying is that the ultimate goal of the Food4All campaign is for everyone to have access to food. And that means regardless of one's immigration status or race or income, it shouldn't matter. And we aim to bring California closer to this vision of Food4All by ending the arbitrary exclusion of California residents from CalFresh and ensuring that everyone who qualifies for food benefits based on their income can get the assistance that they need. It's a really simple premise. It's not surprising that giving people resources to afford food will protect them from going hungry. Um, and as Mar mentioned, CalFresh, which is known federally as SNAP, what it does is it provides benefits that help households afford enough food. Uh, it intervenes in a vicious cycle that I think a lot of us are aware of. We see it in our communities, where growing up in poverty and having difficulty affording food results in families and households making hard choices, poor nutrition outcomes, poor health outcomes, and that makes it more difficult to escape from food insecurity and poverty. There's a wide breadth of research nationally that has demonstrated that CalFresh and food benefits are associated with reduced food insecurity, decreased levels of poverty, and improved uh, health outcomes. So what it does is it helps disrupt this cycle that we're looking at. Next slide. So one example I'll start with is that participating in CalFresh prevents poverty for nearly 700,000 Californians every year, and that includes more than 300,000 children. Studies reported by the White House have found that in low-income households with children, food insecurity among children fell by roughly 33% after their families had been receiving food benefits for about 6 months. So we can say that CalFresh it does, reduce food insecurity. However, there's an estimated 625,000 undocumented adults in California that have household incomes below the official federal poverty threshold. Across our state, undocumented adults experience these poverty conditions at more than twice the rate of the total adult population, which makes it important to remove these exclusions. Early access to food benefits can improve birth outcomes and long-term health, and the health benefits that this provide offsets some of the stress associated with food insecurity and make it easier to manage chronic illness. One data point I'd like to highlight because I think savings really speak to how we make decisions in California. SNAP participation results in approximately $2,000 per year in medical cost savings among income eligible seniors ages 65 and older. One other thing is that SNAP is good for local economies. Each dollar spent in federal SNAP generates $1.79 in economic activity. And during COVID, food benefits used, for example, at farmers markets increased, which indicates that these food benefits have been necessary in providing crucial support to small scale farmers and immigrant entrepreneurs in our food system. Investing in food can help disrupt the prison to deportation pipeline that impacts immigrant communities and separates us from our loved ones. A study by the National Bureau of Economic Research found that SNAP enrollment in children under 5 resulted in a significant decrease in likelihood of being incarcerated in the future down that person's life. So every dollar spent in SNAP reduces the amount of money that we put towards mass incarceration. For individuals who are formerly incarcerated transitioning back into their home communities, food benefits can help to meet their basic needs during the period in which they're searching for jobs or housing. So there's a lot to say about the benefits of CalFresh, and that's why Food4All is trying to remove those exclusions from our communities. Next slide. So despite how well we understand the positive impacts of food benefits, CalFresh helps people pursue their dreams with less stress. It helps prevent chronic illness. It fuels our bodies and our communities. There are still 690,000 to 840,000 Californians who are excluded from our programs just due to their immigration status, just due to a piece of paper, frankly. And in 2 years, this campaign has made immense progress to change this. This past budget year, the governor and the legislature signed a budget that invested in the expansion of CalFresh to residents over the age of 55, regardless of status. But as you can see on the slide, there's age groups below the age of 55 where people are still experiencing high rates of food insecurity. The state estimates that this expansion will benefit an additional 75,000 Californians each year, but there's still hundreds of thousands of California residents who will still be left out. To add to the data that Mar shared earlier, 64% of undocumented children are affected by food insecurity, and a majority of the undocumented population living in food insecure households are between the ages of 27 to 49, which are not covered by this expansion. This year's a win, no doubt, but there remains work to be done to ensure equity for all immigrant communities. This includes Latinx communities, AAPI communities, immigrants from the Middle East, from Africa and the Caribbean. And that's what Food for All stands for at the end of the day. It stands for a California with no exceptions and no exclusions. So that's all I have. And thank you, Jeanette.
No, thank you for sharing all of that with us. It's really interesting to see, you know, how it impacts, you know, our communities and the changes that y'all are trying to make. Sonia, I do want to head over to you and ask, you know, can you share a little bit about your organization's work and your experience fighting food insecurity among the Latinx community, specifically queer and trans Latinx who are undocumented?
Yes, thank you so much. And Ben, thank you so much for sharing those findings. Super honored to be here with you all. Hi, everyone. My name is Sonia Quiñansaka. I am the Programs Director at Gender Justice LA. And for the past 20 years, as one of the first trans-led organizations in LA, Gender Justice LA, we use community organizing, policy advocacy, leadership development, and arts and culture to make concrete changes in the lives of all our TGNC people, especially low-income trans people of color, and then especially undocumented and Latinx and Indigenous and Black folks. We seek to build our community's power to fight for racial, social, cultural, economic, and also food justice. And I wanted to start first by sharing my own personal story. I am Quichua Cañari from Ecuador. And in the left side, you can see a picture of my mom and I. And so I grew up undocumented and had firsthand experience with food insecurity. I know my mother and father did their best to provide us with food, but unfortunately, sometimes it was not enough. And this was not all their fault. This was a systemic issue. I wonder what it would have been if undocumented families like mine would have had access to food assistance programs, if my younger 5-year-old self and individuals like my parents did not have to worry about food access. And unfortunately, the resources that were out there, we were not able to qualify because we were undocumented. And it was also harder to find other resources because of our fear of in the current immigration culture and space that we were in, to be able to feel okay and safe to reach out for help. And so I just wanted to highlight my own personal story in connection to just food justice and the inequity of having access because of my immigration status. As part of Gender Justice LA, one of the things that we did was this large effort to research the impacts that were happening in our communities. And so with the support of the City of Los Angeles AIDS Coordinator's Office and the UCLA Department of Social Services in 2016, we got to survey over 310 community members, which included Latinx, API, Indigenous, Black, and community members. And so we were able to capture the impact of increase of living costs, unemployment, and the impact of how people were able to have the quality of life. And so if we look briefly at the data we have here, most participants reported having low to extreme low incomes. Nearly 70% earn less than $36K per year. And this was despite the fact that nearly 2/3 of our community members, our survey participants, ages 25 plus, had a 4-year college degree, which is twice the portion of the general populations of ages in LA. So one of the things that we wanted to highlight in this report, and that we know firsthand, is that the ways that our community members are impacted by this increase of living costs, unemployment, and just general access to food assistance programs, because we are not creating the space or the ecosystems that help them sustain themselves. And so we are often left thinking, what would it look like if our families, if our community members, if our neighbors had access to a nourishing life, regardless of immigration status, regardless of income, regardless of gender. And so part of the work that we continue to do is do these kind of research projects to capture the impact that it continues to have on our community members, but also to create policies and demand change both on the local level, on the national level, but in spaces like this, because this is an urgent need, knowing that during this pandemic, things have increased in terms of equity. And so, yeah, just wanted to share a little bit about Gender Justice LA, our community research project that captured how our community members were being impacted by all these different inequities that were taking place in our communities, specifically food justice as an important campaign in our organization. Oh, and just like last question, if people want to dive into the report itself, the link is the Transmasculine Health Study, la.org. And if you're a queer, trans, GNC person in LA, we also have our website where if you're looking for like safe spaces or access to food and resources or COVID-19 resources, you can visit that link as well. But thank you for having me here.
Thank you for sharing all of that. I do want to open it up and provide the panelists some time for any of you, if you guys want to like react to each other's responses or add to maybe something that wasn't mentioned, please feel free to do so at this moment.
Well, I just want to thank Ben and Sonia for sharing all that information. I always think it's so important to really look at those intersections, right? Like I really appreciate Sonia's data and information, because at least, for Latinx, there are barriers, and then you add all those intersections around being undocumented or, being transgender, and those barriers become compounded, right? And so for us to be able to understand that, that data piece alone around, transmasculine, being college educated, right, 4-year degrees, and yet still living in poverty, how do we kind of reconcile those things? And I'm sure that, again, that's not sort of isolated. There are very common structural inequities that, that we can point to and say, if immigration status weren't an issue, they could access, this program that could assist, right, in them combating poverty, et cetera. So I just want to thank, Sonia and Ben for sort of illuminating all of that data.
Did anyone want to add something else?
Well, I was going to say about similar to what Mar said. It's just what I appreciate about working on this campaign so far is how we've really tried to be inclusive and understand that there are so many different intersecting experiences. But one of the things that unifies us is just our need to fuel our bodies with food. And I think that's a great starting point for us to really unpack like how we can be accountable to everyone in the immigrant community.
Perfect. Sonia, did you want to add something?
Yes, similar on the same wavelength. I think it is important that our communities do overlap, right? I think that we wish that our communities all had access to nourishing lives, a life of quality and full of dignity. And so just thinking about the incredible work that as part of the Food4All campaign, Gender Justice LA is one of the grantees, and just being able to meet other organizations who are doing just like incredible mutual aid work on the grounds, or who are lifting up the stories who are impacted, of those who are impacted by food insecurity. And then often than not, like we end up finding that there's so much shared space and shared stories and shared experiences. And so really happy that we are able to like have this conversation, but also like point out the intersections and how we're building together to just like address this like food insecurity and how we can imagine better worlds, that I believe that it is possible. And so, yeah. And thank you, Ben, for those data, and Mar too, like just incredible to put like data to the talking points that we're often sharing out.
Perfect, thank you. all so much for all the insights that you know, and your expertise too that you shared with us. I do want to take a question before we head on to our next panelist. And I will go ahead and select Tonia Moses. 1 second. If you can, someone can unmute her. Oh, there you go. Tonia, if you want to come off mute. Or Farah, did you want to? I see a couple of people have their hands raised.
Yes, can you guys hear me?
Yes.
Yes, good morning. Thank you for putting this event together. This is great information we all needed. It's very informative. My name is Farah. I work with an organization, a nonprofit called Smile America. Abdi Foundation was started. My brother, Abdi, was killed 4 years ago. We are a family of immigrants from Africa. There are other communities who are immigrants in this country that are not mentioned or do not know how to get access to these food, educations, and who are undocumented as well. But what we also face and see is that there are adults without children who are do not make much of income, but when we help them or ask them to apply, they said we are denied because we are barely making the above the poverty level. Therefore, we should have enough food. We should be able to sustain, but that's not the case. So how do we include these adults without kids who are barely making it, make it easier for them to apply and approve and have access to food? Thank you.
I can try to take that. Yeah, thank you for your question, and also for just highlighting that there are communities that are still struggling to get access, and especially when it comes to the moment when they enroll. Just besides eligibility, there are other barriers like language access, kind of the whole customer experience. Working with these counties that are often overburdened and have a lot of applications to process. So I'm really sorry to hear that there are community members who are being denied because what I'm hearing is they're just over that income limit, and therefore they're not qualifying for benefits that they would benefit for. So I think just in terms of that, that is another potential way to improve our food policy, is to increase the income limits for someone to be eligible for benefits. I think that's definitely just another goal for all anti-hunger policy advocates. That's something that could be funded at the state level. It's also something that our leaders at the federal level could fix. And then and for communities who may not qualify for CalFresh due to their income or status, we also encourage them to try to find community organizations near them that can provide other forms of food benefits, perhaps a food bank or a food pantry, if folks aren't able to go through our state and local programs.
Yeah, if I could just quickly add to that, in our report, we also discussed sort of like what level of income it would take to just live comfortably, meaning, that you have enough food, you have a roof over your head, and it's $129,000 to just have a basic sort of like living expenses, right? And so we know that many immigrants are not anywhere near that income level or household income level. So absolutely important that we think about, lowering or making just CalFresh and all of these food assistance programs in much more reach than it is now, because we know California is extremely expensive. And again, we talked about this a little bit earlier, that inflation is also a contributing factor right now. So absolutely, yeah, thank you for that.
Thank you. Thank you all for answering the question, and Farah for asking it. I do understand that Assembly Member Santiago has joined us. I do want to remind folk that you can put your questions in the Q&A section. Of course, raise your hand as well. There will be an opportunity for folk to be able to ask more questions at the end. But please help me in welcoming Assembly Member Santiago, who was first elected in November 2014 to represent the 53rd Assembly District, one of the most vibrant and diverse districts in California. AD 53 encompasses Boyle Heights, downtown Los Angeles, Koreatown, Pico Union, and the surrounding areas. Miguel was born in Los Angeles to hardworking immigrant parents. He was the first in his family to graduate from college, earning his degree at the University of California in Los Angeles. At a young age, Santiago jumped into community organizing and public service, driven by a commitment to making healthcare and housing more affordable for all Californians. Assemblymember Santiago has stood up to the Trump administration's anti-immigrant policies. He has defended Californians' vital immigrant communities by delivering millions of dollars for legal services to support unaccompanied minors facing deportation and those affected by the White House decision to terminate temporary protected status. Assemblymember is a champion for immigrants, food justice, and for healthier California. Without further ado, bienvenido, welcome.
Thanks. Gracias for everybody having me on here today. Hey, look, I just wanted to come here and have a frank discussion once you've invited me. And I wanted to start off with that frank discussion by thanking everybody in the Food4All Coalition. This is one of those movements that doesn't have the high paid lobbyist, doesn't have a whole bunch of money behind it. You're not throwing around weight around all over the place, but what it is you lead with passion. You work extremely hard for those who are least fortunate, and I mean that because I represent a district that is the second poorest district in the state of California. Not a race you want to win, but here's where we're at. We also have one of the largest undocumented immigrant populations in the state of California, and people have suffered. I mean, let's just say, let's be honest for what it is. People have suffered when little kids in our neighborhoods go to sleep hungry at night. When they wake up hungry in the morning, and when there's not a nutritious meal. I mean, it's a shame on us and the fifth largest economy in the world that we can't feed little kids. And all the arguments that have been used about why it's not the right time, why it's too expensive, there's long-term budget consequences. Doesn't make sense when we had a $230 billion budget. Today, we've exceeded that by between 80 to 100 billion in excess revenue that we can't feed people in California, no matter whether they're documented or undocumented. I want to put a plug in for the speaker before me, one of the speakers before me, who talked about the federal poverty limit and the number where it's at, because you're 100% right. 25,000 for a family of four is extremely poor, but you're not much richer making 30,000 for a family of four. It's ridiculous to think that somebody could be able to feed their children because they make 26,000 or because they make $32,000 for a family of four. So I want to. That's something that we need to continue to fight for over the next several years. And I come to this with open arms, hoping to engage everybody here on the longer term fight on the issue of income inequality, because we've only succeeded very little in what we're trying to do, which is feed people who are hungry. And this is a fight that crosses sectors, right? Whether you are documented, undocumented, whether you're young or whether you are older, and it doesn't matter the color of your skin or who you love or if you have a religion. I mean, this is the bottom line. We've seen it all over the place. What is interesting, though, is that we were able to succeed in getting 55 and above who are undocumented into the CalFresh program to get some food. What I want to remind everybody is that that's just one step of a long journey, of a longer fight to feed people. So I don't want people to think that we have succeeded and we can rest. And I know that everybody here doesn't, but I want to emphasize that every time that I talk to folks, that this is a larger fight that we will have to continue over the next several decades, because so long as there are people hungry in the state of California, so long as we're the 5th largest economy, so long as we have one of the largest budgets in the United States of America, so long as there are 158 billionaires in the state of California, so long as 5% of the population are millionaires, I mean, it's ridiculous to think that people can go hungry in the state of California, and particularly people of color and people who come from who struggle, work hard every day, pay their taxes, and just don't have this documentation status because the federal government can't get its act together and pass comprehensive immigration reform. Now, having said that, we have made some strides, but I want to emphasize again, I'm going to say this several times, that next year we've got to come back, and we've got some tools that we now know that work. We have a very good argument, a very passionate argument. We have an argument that where people are with us on this, and we got to keep raising it every time. And here's the challenge for us in public office, and the challenge for you, which is every time we talk to somebody, we bring this issue up, because it's got to be at the front and center, and it's got to be the most important thing that we talk about, which is fighting hunger. So I'm encouraging you and hoping to partner with you for the end of the year, to the end of this year and next year when we start our new campaign, to keep raising this up, to keep making noise, to keep going to the press, to keep talking to your elected officials, whether at the city, whether at the county, whether on the school board, whether at the state level, at the federal level, because we are going to make change, but it's only going to happen if we fight hard, we advocate, and we convince people that this has got to be the front burner issue. And we've got a long ways to go. We've got to make sure that we work still on Cal ITC, because we made some gains there. We've got to make sure that the Medi-Cal expansion of undocumented immigrants gets fully implemented, and that we capture and make sure that folks have health care. We've got to make sure that the inflation checks get out to folks, whether documented or undocumented. We've got to make sure that on all the programs that the state does, that we include that conversation about making sure that folks who are undocumented are also eligible for those programs. Because I tell you, it's been decades in the fight. When I first got in the legislature a little less than a decade ago, about 8 years ago, this wasn't always the conversation. The conversation at that time was, let's just try to get healthcare for undocumented immigrants 26 and below. And that was a fight. And I'll tell you, at that point in time, we didn't have all Democrats with us. I mean, this was a time where, shame on us for not having all Democrats with us. Today, folks are with us. We've just got to push a little bit harder and make sure that these important issues get through, get signed, and that they become budget priorities. Thank you very much for having me on today. But I share the same passion that you do, because we've got to do this. It's the right thing to do. It's the moral thing to do. It's an ethical thing to do. And by the way, we've got the money to be able to do it. I like you, don't want to see any child, any person be hungry in the 5th largest economy in the world, where there's 158 billionaires, there's more millionaires than anywhere else, and we've got a budget that is flush with cash. We've got no reason not to do it. So thank you very much.
Oh, thank you. Thank you for, sharing all of that with us. And, I do want to open it up. I know people are excited to ask questions to you. So if anybody wants to ask any questions, please raise your hand. We'll go in order as they're coming in. And you can also drop your questions in the Q&A chat. I'll go ahead and see.
And just, I'll be brief with that every question so that we can get as many through as possible. So don't feel slighted if I go quick.
Perfect. 1 second. If anybody wants to raise their hand or send or drop your questions in the Q&A. Let's see. I don't see anybody raising their hands.
Hey, I took care of it all in one swing. Just kidding.
Right, you answered all of them. No, well, there was, I did want to ask you. You briefly mentioned.
Sorry, Jenna, I think I see someone raising two people raising their hands. So they might not be on the chat, but do you want to start with Adrienne and I can unmute to allow to talk?
Yes.
There we go.
Please.
Yes, because you said that nobody raised her hand. I say, okay, let me do something. Because I know, well, Benjamin, hi, Ben, how are you? I'm Adrienne Bien. I'm here in Los Angeles, California. In fact, yo hablo español también, pero yo soy de África, de Senegal. We met several times at Clínica Romero when we were doing thing. You know, the Senegalese lady speaking 7 languages.
Yeah, I remember.
Yes.
Sí me acuerdo, amiga.
Yes, mucho gusto. I am so proud of the work that is done. I'm just excited because, you know, you are talking about immigrant. I always say we African immigrants are invisible. I'm looking off, you know, what you are doing, and we're going to copy and duplicate it into the African community. Last time we were 30 organizations talking to Congresswoman Karen Bass because she wanted to be mayor of California. You know, we invite her. There were 30 organizations led by Black immigrants, and nobody know that over 5 Black people that you meet in Los Angeles, 1 is an immigrant. Meaning
I'd love to talk to you folks. Invite me over. Look, my district covers Koreatown, and there's a large population of Koreans who are also undocumented immigrants. So I get the breadth of diversity. I'd love to collaborate with you folks.
Absolutely. And myself, I also work with the Senegalese immigrants who are at the border. They don't speak Spanish or English, etc. I work on the asylums files, you know, to make sure that they can get out here in Los Angeles or in other states. But I would be really happy to sit with you, because Koreatown also has a Black population, even if it's usually we say Koreatown, but we don't know that we are also in Koreatown, Boyle Heights, and all this area. We are also having Black immigrants who we don't see, definitely, because we integrate so easily that we don't know. But we have the higher level of poverty in Los Angeles and in California in general. Meaning, I would be pleased, I know we can connect you, but I want to thank you again. Muchas gracias. You're doing an amazing job. I'm going to put that on Twitter right now to share with my people and on LinkedIn. But I want to just to thank everybody, and specifically mi amigo, Los Amigos Benjamin. We do also mental health. We have a program with mental health. Just thanks again.
Yeah, and I would hesitate from thanking me, but rather thanking the coalition. I just happen to be in public office, but an organizer by heart. So I would thank the coalition and include us all in there, because the minute you start saying it's about one person, it's the minute that we can't get this stuff done. We got it done because it was a coalition of people who got together and fought extremely hard, made a lot of noise, and put this at the front burner. So we've got to definitely continue to talk about a coalition that just keeps getting bigger and bigger.
And I'm a member of the coalition of Health for All and Food for All. It's my story with there always when we talk about the lady who is coming here when her daughter was young, 3 years old. She's Latina, she's Afro-Latina, half Nicaraguan, half Senegalese. And she's also the invisible part of the invisible, but we came here when she was 3, she's 19 now in school. But if you look at the story of Adrienne, is me that we are pushing out. I am really so happy to be part of this coalition, the 2 coalition, Health for All and Food for All, definitely.
Thank you, Adrienne. Now we're gonna thank you again, Adrienne, for jumping on. Next, we're gonna go to Fortina Hernandez.
Buenos días, ¿sí me escuchan?
Sí.
Buenos días. Primeramente, quiero agradecer muchísimo a nuestro asambleísta Santiago y decirle que estoy muy orgullosa de lo que hemos logrado. Hemos logrado mucho con avanzar, que ya las personas de 55 años puedan ser elegibles para recibir el beneficio de CalFRES. Yo soy asistente de CalFRES con la fundación de National Health Foundation, y todos los días escucho esto que ustedes acaban de decir. Verdaderamente cierto. Todo lo que sus slides acaban de presentar. Todos los días escucho esto y es triste saber que tenemos tanta hambre en nuestras comunidades y que dentro de ese 63% de niños que tienen inseguridad alimentaria, hay muchos niños sin documentos que no son elegibles para CalFRES. Y es aquí donde está la necesidad de que necesitamos seguir luchando, que no nos deje asambleísta Santiago, que aquí estamos para trabajar juntos, que hay mucha hambre y lo más triste es ver que en el día hay gente que quiere aplicar para CalFresh y cuando le pregunto cuántas personas son en su familia, entre esa familia hay 2 niños o 3 menores de 18 años o entre 25 y son indocumentados. Entonces, es tiempo, como dice nuestra propuesta, de quitar las exclusiones de quién eres, tienes documentos o no. Todos tenemos hambre. Y el hambre no es un privilegio, es una necesidad. Sí, estoy muy orgullosa. Siempre he seguido esta propuesta y he trabajado desde que comenzó. Y estoy orgullosa de lo que hemos logrado, pero sé que vamos a lograr más. Y tengo esa fe donde un día vamos a poder decir, sin excepción y sin exclusión, todos elegibles para CalFresh porque todos tenemos derecho a comer. Aquí estoy para apoyar y siempre trabajando junto con usted y gracias por esta lucha.
Gracias, Fortina. Next, I'm going to go ahead and ask a question that's in the chat. We do have just a little bit more time. This is from Susan Potter. What is the next step in this fight at the state or federal level?
Sure. Well, here's what I would say very quickly. Number one, we got to press really hard on an implementation date. That has got to be key. With that piece wasn't talked about enough because we wanted to get it set in stone in policy. Number two, we got to make sure that everybody else is covered. And then I also want to also say that another piece of this conversation, and I said it earlier, is in all the areas that when we talk about assistance, when we talk about programs, they include people who are undocumented because it can easily be left behind. So one of the things that we always do when a program comes up, we want to try to figure out that folks who are undocumented are also eligible for those programs, because it's really easy to forget when you're setting up these programs conveniently in some cases. Like for example, when we did the rental assistance program, that was something that we fought for to make sure that people were not excluded. Likewise, when we did the inflation rebate checks, we wanted to make sure that it was done through FTB, because therefore anybody who files taxes would be able to receive those benefits. And that would include ITIN participants. That means anybody who has an ITIN number who is undocumented. And then look down the line, I think we do need to have this conversation about increasing thresholds on some of these programs, because just because you make $1,000 over the limit doesn't mean you're doing much better. I was a victim of that too when we were young kids and our parents were enrolling in different assistance programs. I think most of you know my parents were undocumented. They came to the U.S., had my brother and I, but I remember very clearly as a kid the decisions that families had to make when they couldn't qualify for programs because you were just above the threshold. That is a real problem that we have to address. Thank you.
Jeanette, I think you're muted.
Thank you. Sorry about that. Next question. Let me see really quickly. I just want to make sure that we get an opportunity for everyone to get their questions answered.
I think we have time for one more question, Jeanette. I know that folks, it's a very lively Q&A, so we can answer those by email, but I think we have time for maybe one of the people that are raising their hands.
Perfect. 1 second. Sorry, I'm trying to get the...
Yeah, we can unmute Yang Ang. Mm-hmm.
Hi, so I have a question for you, Assembly Member. I know we talk about a lot of deficiency of the SNAP program or CalFresh, right? One of them is the outdated federal, poverty line that is used almost universally across the states, across the country, and we know that every state the GDP is a bit different. So, and we talk about the cost of living in California is significantly and relatively higher compared to other states. So is there a plan at the federal level? because really we need to have a long-term solutions to our CalFresh program or SNAP program across the country. Is there a plan or just talk only that to change the income eligibility level to reflect more accurately every state? So instead of having a one shoe fits all solution, right? Would the federal government be prepared to have different income limit for different state based on their GDP or cost of living?
Yeah, the short answer is not that I'm aware of. No, and obviously you know that I serve at the state, but I've never to date heard of a federal plan to address that. But I think you are absolutely right. $25,000 in California is very different than $25,000 in a different state. But no, not that I'm aware of.
You see, I think that really lies the root of the problem, because you and I would talk about this again and again, right? And we never get to the root of the problem, because really to solve this deficiency, this problem, we really need to go all the way to federal government and to address it and confront it. Like you say, we don't want this issue to be at a back burner. We don't want it to be fading away just because there's a change of leadership in the White House every 4 years or so. We want it to be addressed front and center. And this is really a good time, because we know that we have a White House administration that is more compassionate and more in tune with the hardship of the people. I think this is the best time to address it head on. And I know the White House is organizing this conference on hunger and nutrition up in September. I mean, I see the tide is in our favor. So I'm just wondering, what is your plan? What is the, I'm sure you must have thought about it. We really need to really address this issue at the upstream level.
No, I don't disagree with you. I think we probably need to lobby the federal government. I mean, that's probably what we need to do, and I'll join you I'll help join with you. But given the fact that they have a current number, I'm not thinking about it. We probably take a look at what we can do in the state of California outside of the federal government too. And I'm open to taking a look at that 100%.
Perfect. Thank you again for your question. Unfortunately, that is the only questions that we can take for right now. I know there were so many submitted, and we appreciate everyone for submitting your questions. They will be responding to them, via email, but we appreciate everyone for attending. But don't leave just yet. We want to thank all of you so much for attending our town hall today. We wanted to provide you with an action all of us can take today. Please take the time to email your representatives and thank them for including Food4All, and ask them to continue prioritizing Food4All funding next year as well. And thank you again for attending. Thank you for the presenters, the panelists, Assemblymember Santiago, and for everyone for participating. Just thank you. This is a big thing, a big topic, and I'm pleased to see so many of you here, in conversation. Thank you again. I'm glad you all enjoyed it.